All right, folks. Good Friday afternoon. Thank you again for joining the daily briefing on the City of Philadelphia's response to COVID-19. Today, all the speakers are joining the briefing virtually to adhere to social distancing guidelines. And we will begin our briefing with opening remarks from the mayor. And Mayor, you now have the floor.
Thank you very much, and good afternoon to everyone. As I said in my open letter to residents today, the streets are quiet, but the spirit of this great city has not and will not be diminished by this virus. Philadelphians and our neighbors across the region continue to come together to support each other during these difficult times. The PHL COVID-19 Fund, launched 3 weeks ago as a joint initiative between the Philadelphia Foundation and the United Way of Greater Philadelphia, continues to grow in order to aid nonprofits on the front lines of this pandemic. The fund announced their first round of grants on Wednesday, providing over $2 million to 44 nonprofit organizations serving a diverse range of residents across 10 different counties in southeastern Pennsylvania and southern New Jersey. The fund will continue to announce new rounds of grants every week. And thank you to Exxon Corporation, Citizens Bank, Comcast Corporation, Target, Michael Rubin, and UGI for continuing to grow this crucial fund. Their support, in addition to more than 2,000 individual donors, has raised over $13 million in a short amount of time. The application deadline for the first series of grants is 5 p.m. on Monday, April 13th. Individuals can continue to contribute online at phlcovid19fund.org. That's phlcovid19fund.org. This week, we also announced the creation of a COVID-19 Arts Aid PHL, a new emergency support fund focused on the arts and culture sector in the Philadelphia region. I want to thank our Office of Arts and Culture and the Creative Economy, the Greater Philadelphia Cultural Alliance, and the Philadelphia Cultural Fund for their work on this and for putting up the seed funding to begin. COVID-19 Arts Aid PHL will support individual artists as well as small arts and culture organizations and mid-sized organizations whose operations, work, and livelihood have been deeply affected by this pandemic. It launched earlier this week with a $3.45 million in support, led by a $2.5 million grant from the William Penn Foundation, and God bless the William Penn Foundation, I can tell you. Additional support has been received from the Barra Foundation, the Wincote Foundation, Doris Duke Charitable Foundation, Connolly Foundation, Independence Foundation, Lenfest Foundation, and the Victory Foundation. Thanks to all. Thanks for stepping up to support the arts in our city. I also want to acknowledge Kelly Lee and her team from the Office of Arts, Culture, and the Creative Economy for supporting this effort. If you would like to give, please visit donate.artsaidphl.org. That's donate.artsaidphl.org. Now, I would like to give a few thank you Philly shout outs. First, I would like to recognize the Philly Shipyard and the Metal Trades Department of the AFL-CIO. Good news. Just this week, they were awarded a $630 million shipbuilding contract by the U.S. Department of Transportation's Maritime Administration. This initial contract allows them to start work on building 2 ships at the shipyard, with the possibility of 5 total ships being built right here in Philadelphia. If all 5 ships are ordered and built in series, the total contract value would be approximately $1.5 billion. This would allow the shipyard to bring 1,200 jobs back to South Philadelphia starting in early 2021. Good luck to all. This is welcome economic news during these very difficult economic times. I also have to thank our friends at the Greater Philadelphia Hotel Association, Philadelphia Convention and Visitors Bureau Foundation, Visit Philadelphia, and the Pennsylvania Convention Center, and the Philadelphia Hospitality Investment Levy. Philadelphia tourism and hospitality industry has been among the hardest hit by this crisis, but our local hotels and tourism agencies are stepping up in a very big way. They launched the Greater Philadelphia Hotel Association COVID-19 Hospitality Workers Relief Fund with the goal of raising enough funds to supply every laid off hotel employee in the city with a $100 gift certificate for groceries. So go to discoverphl.com for more information. That's discoverphl.com for more info. We also have two announcements regarding the Philadelphia COVID-19 Small Business Relief Fund. First, the deadline for micro businesses to submit applications for funding is midnight on Wednesday, April 15th. Midnight on Wednesday, April 15th. The relief fund, which launched on March 23rd with a $9.25 million, has already received over 6,000 applications from firms seeking more than $82 million in aid. So it's clear that our small businesses are really hurting. This is why we're continuing to identify additional funds that we can dedicate to business relief. To that end, we are pleased to announce an additional $2.9 million has been secured, bringing the total to more than $12.1 million to disperse to local businesses impacted by COVID-19. The additional funding includes generous donations from the Knight Foundation, Citizens Bank, and PNC Bank, as well as repurposed funding from PIDC and the city. We'll continue to process applications as quickly as possible and expect that up to 1,000 local businesses will receive awards from this fund. Additional resources, including information about federal relief programs for businesses, are available on our website at phila.gov/commerce. That's phila.gov/commerce. And before I turn it over to Dr. Farley, this is Easter week. Today is Good Friday, and Easter Sunday's coming. Just keep everyone in your prayers, and hopefully, as Jesus rose from the dead, we can rise from this pandemic and move forward and in a productive way. So God bless everybody. Make sure you don't visit your elderly parents or grandparents, but call them on the phone and wish them happy Easter. God bless us all, and thank you. Dr. Farley.
Good afternoon. So here's the health update. We are continuing to see a slowing in the growth of coronavirus cases in the city. Our healthcare system is seeing more patients, and they're busy, but they are so far being able to handle it. So here's more detail. Today, we've had 522 new cases of the coronavirus infection diagnosed in Philadelphia residents, bringing us to a total of 5,793 since the beginning of the epidemic. Now, that daily count of 522 is similar to what we've seen in the last few days, which is that marker that the growth is slowing. That's good news, but let's be clear, the virus could pick up speed again. So we just have to follow those numbers closely, and we hope this is where it tops out, but we can't say that for sure at this point. We're continuing to see clusters in congregate settings, such as nursing homes and behavioral health facilities. Our work with City's Jail is showing that we now have 5 new positive tests in inmates, but 2 others have recovered. So we're now at 64 total inmates with the infection in the system. Now, I do have to report, sadly, that there are 35 new deaths from the coronavirus infection in the city since this time yesterday, bringing us to a total of 137 deaths. That 35 new deaths is the largest daily number we've had yet. Now, the number of deaths lags behind the number of cases that we get. So the increase we saw in cases in the past week or two is following up now with this increase in deaths. So this increase was expected, but it's very sad. Of the 137 deaths, 67 were in nursing home residents, and 89 or 65% were over the age of 70. So just to be clear, what we thought was going to be the case in the beginning is true, that most of the people who die from this infection are particularly vulnerable. They're elderly people or people who have chronic illnesses. However, there are some people who are younger and healthy who got this infection who have not survived. So it can absolutely be dangerous for anybody. An update on testing. Testing is available pretty much as it was before. The main thing for you to do if you're interested in getting tested is go to our website, phila.gov/COVID, go under FAQ, and you'll see all the different links and phone numbers for the sites around the city. The Citizens Bank Park site today will be closed because of high winds. Yesterday, the winds were so high that they tore apart some of the tents that were down there. We couldn't operate. Today, the winds are supposed to be even higher. So unfortunately, that site's not available today. However, the Center City site that we have available is still open 7 days a week. If you're interested in getting tested and the other sites are not appropriate for you, just call this number and see if this is appropriate for you there. The number is 267-491-5870. And again, testing is for people who have symptoms and are either healthcare workers or over the age of 50. Now, what's the update on our hospitals? They are seeing a steady increase in the cases of this infection in their system. Overall, there are now 717 people with this infection in hospitals across the city. and a total of 1,231 in the entire Southeast Pennsylvania region. That is keeping the hospitals busy. I spoke to the chief medical officers of the hospitals last night, but they're handling it. So far, we're okay. So as far as for everyone else in the city, the message is that despite the better news on cases, we still need to be very serious about staying safe. The virus is still circulating in every neighborhood and every population. If we start behaving as we behaved before all this began, there's no question the virus will surge again. And we may not see it immediately. We may not see it for a couple of weeks. So we need to take this very seriously right now. Stay home. If you have to go out, for example, you have to go to work because you're an essential worker, or you have to go to the grocery store, keep your distance from people. When you're around people, wear a mask. For more information, www.phila.gov/COVID. If you have medical questions, 822-722-7112. Thanks.
Mensaje del alcalde Jim Kenney para el viernes 10 de abril del año 2020. Buenas tardes a todos. Como lo señalé en mi carta a los residentes el día de hoy, las calles están tranquilas, pero el espíritu de esta gran ciudad no ha sido doblegado ni se rendirá ante esta crisis de salud pública. Los habitantes de Filadelfia y nuestros vecinos de la región continúan apoyándose mutuamente durante estos difíciles momentos. El Fondo PHL COVID-19, creado hace 3 semanas como una iniciativa conjunta entre The Philadelphia Foundation y el United Way of Greater Philadelphia, continúa creciendo para ayudar a las organizaciones sin fines de lucro en la primera línea contra la pandemia. El fondo anunció su primera ronda de subvenciones el miércoles, proporcionando más de $2 millones a 44 organizaciones sin fines de lucro que atienden las necesidades de un gran número de personas en los 10 condados diferentes en el sureste de Pensilvania y el sur de Nueva Jersey. El fondo continuará anunciando nuevas rondas de subvenciones semanalmente. Les agradecemos a Exelon Corporation, a Citizens Bank, Comcast Corporation, Target, Michael Rubin y UGI por contribuir al fondo. Su apoyo, junto al de otros 2,000 donantes individuales, ha recaudado más de $13 millones en muy poco tiempo. El lunes 13 de abril se cierra el plazo para solicitar fondos en esta primera ronda de subvenciones. Las personas e instituciones pueden seguir contribuyendo en línea a través del phlcovid19fund.org. Y esta semana también anunciamos la creación del COVID-19 Arts Aid PHL, un nuevo fondo de ayuda de emergencia orientado al sector de las artes y la cultura de Filadelfia. Quiero agradecer a nuestra Oficina de Artes, Cultura y Economía Creativa, a la Alianza Cultural del Gran Área de Filadelfia y al Fondo Cultural de Filadelfia por su arduo trabajo. El COVID-19 Artist Aid PHL apoyará a los artistas, así como a las pequeñas y medianas organizaciones culturales cuyas operaciones, trabajo y medios de vida se han visto profundamente afectados por esta pandemia. Esta iniciativa se anunció a principios de esta semana con un fondo acumulado de $3.450.000 gracias al aporte de la William Penn Foundation de $2,5 millones y al apoyo adicional de The Barnes Foundation, Wincott Foundation, Doris Duke Charitable Foundation, the Connolly Foundation, the Independence Foundation, the Lenfest Foundation y la Victory Foundation. Gracias a todos estos grupos por apoyar las artes en nuestra ciudad. También quiero agradecer personalmente a Kelly Lee y a su equipo de la Oficina de Artes, Cultura y Economía Creativa por su gran esfuerzo. Si desea hacer una donación, visite donate.artsaidphl.org. Y por supuesto que hay que agradecerle a toda Filadelfia por su apoyo durante esta crisis. Primero, me gustaría reconocer al Philly Shipyard y al Metal Trades Department de la AFL-CIO. Justo esta semana, la Administración Marítima del Departamento de Transporte de los Estados Unidos les otorgó un contrato de construcción naval de $630 millones. Este contrato inicial les permite comenzar a trabajar en la construcción de 2 barcos con la posibilidad de construir un total de 5 barcos aquí mismo en Filadelfia. Si los 5 barcos se construyen en serie, el valor total del contrato sería de aproximadamente $1.500 millones. Esto permitirá que en el sur de Filadelfia se generen 1.200 nuevos puestos de trabajo el año 2021. Esta Es una muy buena noticia en medio de estos momentos difíciles. También les tengo que agradecer a nuestros amigos de la Greater Philadelphia Hotel Foundation, al Philadelphia Convention y al Visitors Bureau Foundation, a Visit Philadelphia, al Pennsylvania Convention Center y al Philadelphia Hospitality Investment Levy. La industria del turismo y la hospitalidad en Filadelfia están entre las más afectadas por esta crisis, pero nuestros hoteles y agencias de turismo locales están dando un gran paso hacia adelante. Ellos han lanzado el Fondo de Ayuda para Trabajadores de Hospitalidad COVID-19 del Greater Philadelphia Hotel Association, con el objetivo de recaudar fondos suficientes para proporcionarle a cada empleado que haya sido despedido en la ciudad un certificado de regalo por $100 para comprar alimentos. Visite discoverphil.com para más información. Finalmente, tenemos 2 anuncios sobre el Fondo de Ayuda COVID-19 para pequeñas empresas en Filadelfia. Primero, la fecha límite para que las microempresas presenten solicitudes de financiamiento es este miércoles 15 de abril antes de la medianoche. El Fondo de Ayuda, anunciado el 23 de marzo con $9.250.000, ya ha recibido más de 6,000 solicitudes de empresas que buscan más de $82 millones en ayuda. Por tanto, nos queda claro que nuestras pequeñas empresas están sufriendo las consecuencias de esta crisis y por ello continuamos identificando fondos adicionales que podamos dedicar para ayudar a estas empresas. Con ese fin, nos complace anunciar que se ha asegurado $2.900.000 adicionales por un total de más de $12.100.000 para apoyar a las empresas locales afectadas por el COVID-19. Los fondos adicionales incluyen generosas donaciones de la Fundación Knight, del Citizens Bank y del PNC Bank, así como fondos reutilizados de PIDC de la ciudad. Continuaremos procesando las solicitudes lo más rápido posible y estimamos que hasta 1,000 negocios locales recibirán financiamiento de este fondo. Estos recursos adicionales, incluyendo información sobre programas federales de ayuda para empresas, están disponibles para su consulta en nuestro sitio web en philadelphia.gov/comercio. Y esta es la actualización en materia de salud al 10 de abril del año 2020. Desde ayer se han confirmado 522 nuevos casos de coronavirus en Filadelfia y actualmente tenemos un total de 5,793 casos en la ciudad. Estos casos están aumentando lentamente. La ciudad está monitoreando de cerca estos números. Tenemos 5 nuevos casos de COVID-19 entre internos, para un total de 64 casos registrados. 2 internos se están recuperando satisfactoriamente. También reportamos 35 nuevos fallecimientos en Filadelfia. Este ha sido el número más alto de fallecimientos registrado diariamente. Tenemos un total de 137 personas que han muerto por el COVID-19. 67 de estas muertes se han producido en hogares de ancianos. 89 muertes, o el 65% de ellas, se han producido en personas mayores de 70 años. Este virus no discrimina por raza o por género. En Filadelfia hay más de 20 centros de prueba. Por favor, consulte el sitio web fila.gov/COVID-19, pestaña FAQ, para ubicar el más cercano a su hogar. El centro de pruebas ubicado en Citizens Bank Park cierra sus puertas el día de hoy. El centro de pruebas de la ciudad en Center City está abierto en horario regular y continuará atendiendo a personas mayores de 50 años, trabajadores sanitarios y que presenten síntomas del COVID-19. Si cumple con estas condiciones, llame al 267-491-5870 para hacer una cita. Recuerde que debe ser requerido por su médico primario o médico de cabecera. Los hospitales están monitoreando el crecimiento de los casos. En un total de 717 pacientes que están hospitalizados en Filadelfia y un total de 1,231 en la región sureste de Pensilvania. Tenemos que cumplir con la medida de permanecer en casa para permanecer seguros. El virus sigue circulando en nuestro ambiente. Si nos comportamos como antes y no respetamos la orden de permanecer en casa, el virus se propagará rápidamente. Si debe salir a trabajar, le recomendamos mantener la distancia social de 6 pies, lavarse las manos y utilizar máscaras de tela en lugares públicos donde cumplir con las medidas de distanciamiento social sea difícil, especialmente en áreas de transmisión comunitaria significativa, como por ejemplo supermercados o farmacias. Le invitamos a consultar el sitio web para mayor información, www.fila.gov/COVID. Y recuerde que puede usted llamar al 311 si tiene preguntas sobre el COVID-19. Hay servicio de traducción disponible en 100 idiomas. Si tiene preguntas de carácter médico, puede llamar las 24 horas del día, los 7 días por semana, al 1-800-722-7112. Y esta llamada es gratuita. Gracias.
Okay, thank you, Armando. And we're now going to move to the Q&A portion for members of the media. I'd like to ask the speakers, Managing Director Brian Abernathy, Mayor Kenny, and Dr. Farley to now join us again with audio and video. Please remember, of course, we have limited time during these briefings, so only one representative for each media outlet is permitted, and reporters are asked to limit their questions to 3 or fewer. We will do a second round of questions if time permits. So for those logged in today, please use the raise your hand feature. It can be found under the participants list. And please remember to turn on your video to ask your question if possible when you are called on. We're going to start off now with Martin Pratt of Philly YBN. Martin, can you hear us? Because we are not hearing you. All right, Martin, we're going to come back to you in a minute. Let's go to Lauren Make of NBC 10.
Hi, this first question is for Dr. Farley. Wanted to get a little more insight from you on how you are viewing these numbers. You said today we are seeing the highest number of deaths. Do you consider us to be in the city at the peak, or should we expect that we will see these numbers continue to rise?
Well, it depends on whether you're talking about cases or deaths or hospitalizations. The number of cases has been fairly steady, between 500 and 550 for the past few days. If we're fortunate, that's a plateau that it will hit. However, the number of deaths is going to lag behind that. That's a lagging indicator. So I would expect the number of deaths each day to increase. I can't tell you how many more days it'll increase before that plateaus.
Okay. On the testing site, you mentioned that the South Philadelphia testing site was closed today. I know the federal government had reversed course and was willing to continue participating in sites like that one, but that this one will be closing. Will the city, as a result, be asking the federal government to offer its resources or participate in a different site?
We are absolutely going to be getting the federal resources and using them at multiple sites across the city. That particular site was responsible for 7% of the tests in Philadelphia residents. So it was a fairly small site and was fairly labor intensive. We had many staff out there, and the test results came back in about 5 or 6 days. Some of our other sites are in neighborhoods. They're more easily accessible to Philadelphia residents. They're going to laboratories with a quicker turnaround. And so we think if we use the test kits and other materials that were given to us by the federal government at that site and distributed them to other sites across the city, we can actually make testing more accessible.
Can you be specific at all? And you're going to be asking for their help with any other specific sites?
Well, it's really the materials. It's the test kits, the swabs that they use to collect the sample, and the personal protective equipment that is in such short supply. So that's what we're going to be giving to other sites across the city in return for their increasing accessibility of testing.
Okay, and last thing, we've talked over recent days about the impact on the African American community and how that has been showing up in the numbers. What specifically has the city done to address that and to reach out to those in the African American community?
So I summarized that yesterday, but the idea is we're trying to communicate through as many channels as possible that will reach in the African American community, such as taking out ads in ethnic newspapers, working with city council members, working through ministers and pastors, through our Reverend Naomi's communicating with them. We have inserts into the water bills for people. Our census takers, they're going out there doing the census, are also be giving messages they can deliver. So every channel we can think of, in addition to the publicity that you're giving, is really honing in on this message of stay home, social distancing.
Mike Dunn, you are unmuted. You need to unmute yourself.
All right, let's try this again. Martin Pratt of Philly YBN, are you there?
Yes, I'm here. Can you guys hear me?
Long week, yeah. Go ahead.
Yeah, okay. Yes, it has been a long week. Happy Passover and happy Easter to everyone. Thank you guys for doing this. 3 questions. First question is for Dr. Farley. In New York and other cities, they've started using CT scans as a way to get faster results and to try to diagnose COVID. Are we thinking about doing the same thing?
You know, I haven't talked to the doctors in the hospitals about that specific question, but my guess is they do that as a matter of routine. When someone comes in who has respiratory complaints and they're trying to see the condition of their lungs, they would do a chest CT scan. Now, if they have a positive test result, their regular x-ray looks okay, they may not need to do that scan, but that kind of technology is accessible in our hospitals.
Okay. Would the health department put that out as a standard, as a way to around, if we get to a point where we're running out of tests, that we can start to do CT scans?
You know, the CT scan is really, it's a test to aid the doctor in the treatment of the patient. It's not something which we use to count cases or not count cases. So, and I wouldn't want to try to set rules for when they use that scan or not. They'll use it when it's appropriate. I'm confident about that. The really only thing we can do to count cases is through the test results. But the hospitals do have enough of these testing, despite its limits, to be able to test every patient who's in their facility to see if they have the infection.
Gotcha. Another question, Dr. Farley. Allegedly, the White House said some things this morning to African-American stakeholders and leaders. And in that conversation, the CDC mentioned that they were doing more data gathering for African-American statistics. Have they reached out to you and asked you for more data?
Not that I'm aware of. We do talk to them regularly, but I haven't checked in with my staff on that since, in the last 24 hours. I can say we are trying, I mentioned this yesterday, we're trying to see with our data on cases, which is mostly missing data on race, trying to see if we can match that up with other databases and pick up the race element from those other databases so we can complete the picture a little bit better. And I'm a little more optimistic than I was yesterday that we may be able to do that. So we'll have a little bit better picture maybe sometime next week.
Okay, and last question for you, Dr. Farley, is that in my neighborhood, I observed a bunch, unfortunately, of campaign workers grouping together and doing door knockers and other things to advertise for a campaign that's not happening until June. Is this something that the health department would advise candidates to discontinue at least until we, look back in 30 days? Or are we okay with campaign workers hitting the streets and passing out flyers and door knockers and knocking on people's doors?
We would not recommend that. Our messages, I think, are pretty clear. Stay home unless you really have to go out. Really have to go out means you got to go to the grocery store. You got to go pick up some medicine, not political campaigns or whatever other campaign you're talking about.
Okay, thank you. Thank you, Martin. Next up, Laura McChrystal of the Inquirer.
Hi. I'm wondering, first of all, if there are any updates on the city's efforts to purchase masks. I know it was mentioned last week that the one order never made it here from overseas. Any updates on masks or other PPE?
So we are continuing to source multiple potential sources around N95 masks and other PPE, but I don't have any specific update. I believe we did pick up some surgical masks, or at least we were supposed to yesterday. I can confirm later today numbers on those surgical masks. And we also recognize isolation gowns are an urgent need at some of our facilities, and we're working to try and source that as quickly as possible.
Okay. And do you have any other information on whether, since federal officials have been talking this week about Philly as a hotspot, whether you'll be getting any other resources from the federal government?
So they're talking about it as a hotspot, but I don't think they have named us a hotspot yet. But certainly we would welcome any additional resources the federal government provided. But we haven't seen anything yet.
Okay. And the meal distributions or the food site distributions, I'm just looking for an update on that. I know it was mentioned last week that the number of boxes provided had been expanded and that even then some sites were still running out. Is that still going on?
Yes. So our food distribution is going strong. I can get you specific numbers later today. I don't have them on me, but it's going well, both through the school district, through our general food distribution. We are also working with the Pennsylvania Corporation on Aging on distribution of food to seniors as well, to seniors and the disabled individuals. So I think we're doing our best to make sure that network is maintained and supported throughout this crisis. Again, we'll get you the number of meals distributed this week. One note that I think the mayor has made significantly over the week has been Monday's food distribution through the schools will be delayed until Tuesday. And so any help you all can give us to make sure folks realize that food distribution on Monday will be pushed to Tuesday at our schools.
If I could just quickly clarify that question, have you still had, sites with long lines at the point where they run out of meals? Have you increased the number of boxes you're giving away or anything like that?
So we have had some sites continue to run out of food. I think again that speaks to the broad need that we recognize. We are trying to redeploy resources, and so there are some sites that haven't given out all their food, and we're trying to redeploy those resources to sites that have a larger need. And so I think we're doing better. That's not to say that there's not improvement needed. There's always improvement needed, but considering how large this operation is, how dependent upon volunteers it is, I think it's pretty impressive, and really appreciate the team that's been working on it.
Great, thank you, Laura. Next up is Layla Jones of Billy Penn.
Hello. I had two questions for you guys. First was, what was the dollar amount of the FEMA funding that had previously gone to the South Philly site? Since it's not actually getting cut off. And I know the mayor said he hoped to direct that money toward rapid testing. So I'm wondering about how many tests those funds could buy.
I don't think we know at the moment because we haven't had direct discussions about rapid testing kits with the administration. But it's one of the leverage points we hope to have with the closing of our site to be able to move to rapid testing kits, which will be more effective in the long term by helping to get this, knowing when it's right to open up the city again for business.
And if I could clarify that the South Philly site, it wasn't funding that the federal government was giving us. It was just materials and supplies and the testing. So it wasn't dollars. And the test kits, the swabs that you use will be used in other sites.
Okay. And those test kits and swabs will continue to come in and just be distributed to the other sites then?
Yes.
Okay, thank you. And another question I had, one of our readers had noted that his neighbors keep having parties and he's upset that they're not social distancing. So what course of action would you all recommend he take? And once he does, what steps will the city take to kind of shut that down?
Certainly, if folks are having parties, he can call 911 for the police to respond. The police have responded to a number of incidents and asked folks to disperse. They can issue citations if they think it's appropriate. Hopefully, in cases they'll disperse on their own. But certainly, that's within the officer's discretion on how to handle that.
Okay, thank you.
Thank you, Layla.
And can I clarify just while I have it, going back to Laura's question, we do have 1 million surgical masks arriving now, and we also received 100,000 N95s from multiple sources.
Great, thank you. Next up is Manny Smith of CBS 3.
Good evening, afternoon, everybody. We have 3 questions. I'll start with number 1. There's been some social video circulating widely of a man being removed by police from a SEPTA bus, presumably for not wearing a mask. My question is, are you guys aware of this, number 1? And number 2, do you agree with that level of law enforcement being involved to enforce social distancing?
Sure. I can start then, Mayor, if you want to take it from there. So I think, first of all, yes, we are aware of the video. And my understanding is that an individual was riding the bus without a mask. The bus driver asked that individual to leave the bus or to get off the bus. He refused. He pulled over and called the police, and the Philadelphia Police Department responded and was acting based on the bus driver's concerns that the individual didn't follow direction. And that's the response that the police were responding to, was the driver saying he kicked him off the bus and he didn't exit on his own. From my understanding, SEPTA's policy is a strong recommendation to wear a mask while riding in the bus and not a requirement. But I don't think our officers are in a place to mediate that description. When a bus driver says he's kicked somebody off for whatever reason, our officers are going to support SEPTA in that effort, especially given some of the challenges that SEPTA has faced during this crisis. And Mayor, I don't know if you want to add anything.
And let's remember, I mean, our SEPTA bus drivers are frontline, on the boots on the ground heroes who go to work every day and need and feel they need for protection. The individual, I haven't seen the video myself, but I understand the individual was not cited nor arrested, but just removed from the bus itself. We're in strange times, and people are reacting in strange ways. But I don't blame the bus driver. He or she, is on an 8-hour shift or more, and wants to feel safe and make sure that the other riders are safe. Again, I haven't seen the video, but there was no arrest and no citation.
Thank you. All right. So just to be absolutely clear, Mayor, as a follow-up, you are comfortable with police being involved in enforcing social distancing measures if people aren't complying?
In this particular case, yes. Again, I haven't seen the video, but I don't expect me to agree with, going out to a park and arresting, 100 people. That's the other end of the spectrum. But people have been put off public transit for many reasons, not just this. As long as there wasn't anything untoward in the operation of removing the person, I don't have a problem with it.
Yeah, and I want to be very clear. The police were not responding to the social distancing complaint. The police were responding to the fact that the person was asked to leave the bus and refused, so failing to follow the bus driver's direction. So I just want to make that very clear, and that was and I would expect my officers to continue to do that and support our SEPTA workers.
Thank you, Brian. The second question is that we've been talking to some residents across the city. They have been complaining about problem landlords and say, hey, they're organizing a rent strike because they, I guess these landlords are not, assisting as much as they could be, I guess, with people with financial difficulty with the rent. What would you guys support that effort, or, would you agree, disagree? Anything you can do for residents specifically who are renters who are struggling financially at this time?
Well, everybody's struggling, including landlords, I assume, because they're not getting rent. And I assume that a number of these properties are mortgaged and they need to pay their mortgage company. I'm not in favor of necessarily a rent strike. I think that each individual case is different, and we could figure out a way to negotiate whatever we can negotiate, or the tenant can negotiate with the landlord. But being a landlord doesn't necessarily mean you're Daddy Warbucks either. It means that you have property that you're renting to people, and you have bills and utilities and other things to pay too. So we're all in the same boat together. And I think we ought to look at this on each case by case basis.
Thank you. And our last question again.
Manny, that was 3, but I'll give you a break here today.
Thank you very much. I appreciate that on Good Friday. I know you spoke about this earlier, Mayor, but again, there's been some extensive coverage of at least one pastor still having live Easter services and encouraging people to come to church. We'd like to get your reaction to that and your advice to parishioners this weekend.
As I said yesterday, God is all empowered, and God can hear you from your home, from your kitchen, or from your couch. I would advise people not to go to mass gatherings of church. There are many, many churches that I know of that are socially distancing by having their services conducted over the internet or live streamed. And I would suggest that's the way to go. With this particular individual pastor that was advertised in the news, was talked about in the newspaper, hopefully there won't be that many people show up to put people at risk. But I don't think we're at a point where we're going to go into churches and arrest pastors and participants or lock the doors. So hopefully people would listen to common sense and pray at home.
All right, thank you, Manny. And next up is Cheryl Spreitzer of 6ABC.
Hi there, how are you? Mayor Kenny just answered one of my questions. The other is for Dr. Farley in regards to hospital beds. Dr. Farley, right now, data showing that 30% of all COVID patients in the state are actually here in Philadelphia County. And we have about roughly 256 ICU beds currently available, with the federal government trying to say that this is going to be the next hotspot. Do you think that number of beds is enough at this point?
First, before I answer that, I got to correct a mistake that I made when I talked earlier. I said that there were 35 new deaths to report today and a total of 137. It turns out it's 33 new deaths. I made an arithmetic error. It's 33 new deaths. The 137 total is correct. So apologize for that mistake. As far as your question, there are many patients who are hospitalized across the region. We're tracking that closely. As I said, we're up to, I believe I said 1,200 people in the Philadelphia region who are hospitalized. Some of them are in intensive care units. Some of them are in general beds. We're tracking the number of beds that are available. The total number of beds in these hospitals is plenty. There's plenty of availability. It's a little tighter on intensive care unit beds. There's still plenty of ventilator availability. So at the moment, we think we're okay. Now, if this gets much worse, if we get a surge in new cases and the hospitals see more cases, then we might bump up against the limits of what the hospitals can do. That's why we have the facility at the Leah Corr Center. We have other sort of fallback options for hospitals to add beds we can put into place, but we need to watch that closely.
Would you be willing to, if as they're talking about hotspots, it looks like they're looking at the entire region, places like Camden or Wilmington who may not have enough beds? I haven't looked at that data specifically, but if you feel like we're prepared, would we be willing to take some of those patients down the road if we need be?
So we have data for Southeast Pennsylvania. I don't have data for New Jersey or Delaware, but already these hospital directors talk to each other. And if somebody has more patients than they can handle and others have rooms, then they transfer patients. And so we would expect that's going to happen within the region in Philadelphia, including New Jersey and Delaware if need be. If they help each other out, that's probably the simplest way to address any shortfall in a particular hospital.
Plus the other issue is that a lot of people from the region use our medical facilities at Jefferson, at Penn, at Temple, and other places. So I don't even know who's in the hospital now that may be from Delaware County or from Southern New Jersey because their doctor's affiliated with a certain hospital. So, I mean, we're a regional center, and whenever we can help people, we will.
Great. Thank you, guys. Happy Friday.
Thank you.
All right, thank you, Cheryl. Next up is Brian Mendoza of Telemundo.
Hola, muy buenas tardes, Armando. La primera pregunta es tal vez para el Dr. Farley. ¿Por qué se tomó la decisión de cerrar el centro de pruebas al sur de Filadelfia? Y al cerrar esta, ¿qué pasará con los kits de pruebas, el staff y los voluntarios que se encuentran ahí?
Armando, you need to unmute yourself there and take it from the top. Hold on. There.
To close the test center in South Philadelphia.
Armando, why don't you back up to the beginning there and start over? Thank you. We're good.
Afternoon, Brian. Sorry for that.
No problem.
Why was a decision made to close the test center in South Philadelphia? And when it closes, what will happen to the test kits, the staff, and the volunteers?
The site, as I said earlier, was responsible for doing about 7% of the tests in the Philadelphia area or among Philadelphia residents. And so we're going to be using the test kits that would otherwise have been used for that site and distributing it to the other sites across the city that are doing many more tests. In many cases, they're doing tests with a quicker turnaround. So we think that we can probably increase the accessibility of testing by using the materials that way.
En ese sitio, como dije anteriormente, se estaban conduciendo 7% de las pruebas para los residentes de Filadelfia. Lo que vamos a hacer con esos juegos de pruebas es enviarlos a los otros lugares dentro de la ciudad donde se están administrando muchas más pruebas con un periodo de respuesta mucho más rápido también para poder elevar el número de miembros que puedan acceder a estas pruebas.
Muchas gracias. La segunda pregunta es, se habla que nos estamos estabilizando en cuanto al número de contagios, pero ¿se puede decir que este ya es el pico de la crisis aquí en Filadelfia o aún estamos esperando un alza en cuanto a casos y muertes?
There is talk that we are stabilizing in terms of the number of infections, but can it be said that this is a peak of the crisis, or are we still expecting to see a rise in the number of cases and the number of deaths?
We can definitely expect to see a rise in the number of deaths, and we'll see whether the daily case count stabilizes here and goes down or goes up. Any of those could happen.
But regardless, what we put in place as far as social distancing and other things need to go on and on and on for at least probably through the summer. And I don't see that changing. We need to continue to modify our behavior and what we're used to doing in order for this not to come back. So, I mean, I don't think whether it stabilizes, whether it goes down, there's still going to be a period of time where this new normal is going to have to persist.
Definitivamente vamos a ver un incremento en el número de muertes. En cuanto al número de casos confirmados, pudieran incrementarse o pudieran reducirse. Yo creo que es importante, y agrega nuestro alcalde, de que las medidas de distanciamiento social sigan observándose y probablemente tengan que hacerse a lo largo del verano todavía. No se puede hacer otro cambio porque lo que hay que cambiar es nuestra conducta para impedir de que este virus pueda volver a regresar, y hay que lograr una estabilización en el tiempo.
Muchas gracias. Y la última pregunta es, ¿qué se está haciendo para obtener más información o data en cuanto a los contagios y muertes entre la comunidad hispana? ¿Y qué están haciendo para alcanzar a más hispanos y notificarles para que no tengan miedo a realizarse la prueba si ese es uno de los factores al no poder conseguir este tipo de data entre nuestra comunidad?
What is being done to obtain more information or data regarding infections and deaths amongst the Hispanic community? What is being done to reach more Hispanics and to notify them that they shouldn't be afraid to take this test?
So we're trying to get more information on the race and the ethnicity of the people who have a positive test. We have very little information on race. We have even less information on ethnicity. We'll see what we can get and report out what we can find. What I said earlier about how we're reaching out to African-American populations, same basic principles, the same basic actions are taking place with Latino populations. Communication through ethnic newspapers, putting information in their water bills, getting the census takers, working with city council members, whatever we can do to try to communicate to populations that may be at risk. And if people have additional suggestions, we would be happy to receive them.
Requerimos todavía recabar más información en cuanto a raza y en cuanto a etnicidad, porque tenemos muy poca información de cuanto a raza y mucho menos en cuanto a etnicidad, pero lo que vamos a hacer es lo mismo que se está haciendo con la comunidad afroamericana, aplicando los mismos principios para contactarlos a través de los periódicos comunitarios, los periódicos en otras lenguas, también en los insertos que están en la cuenta de agua, en las facturas de agua, y las operaciones de los voluntarios del censo. También estamos trabajando conjuntamente con el Consejo Municipal de la ciudad y damos la bienvenida a cualquier sugerencia para poder contactar la comunidad hispana.
Muchas gracias. Y una aclaración, el doctor Farley aclaró que son 33 muertes y no 35. ¿Ese es todavía el número más alto de muertes que se ha registrado en Filadelfia?
Dr. Farley made a clarification that it was 33 deaths and not 35. Still, is this the highest number of deaths that we've seen so far in Philadelphia?
It's the highest number of daily deaths, yes.
Sí, es el número más alto de muertes diarias que hemos registrado en Filadelfia.
Muchas gracias.
Thank you. Thank you, Brian. Next up is Corey Clark of PCN.
Hello.
Hello, Corey.
Oh, thanks. So I apologize if you talked about this in the beginning. What is the status of the teachers and students? Are they ready to do distance learning? Are they ready to do remote learning? And is there a date when that's supposed to start?
So we've been working with the school district to distribute laptops to all of our school kids. That process should be wrapped up at the beginning of May for online distance learning. I think given the governor's message earlier this week, canceling the rest of the school year, we're working with the school district on exactly what that teaching material might look like going forward.
Is there instruction going on right now? Or are we in a holding pattern, or is there any uniformity across the district?
Not across the district at this time. We needed to get laptops into people's hands, and that process is ongoing, but going well.
But so is there instruction going on right now, or say Monday, or what are the kids doing at home right now?
That is my understanding is that there's not instruction happening right now. I think again, this was a pretty massive operation to get laptops and Chromebooks out to the entire school district that needed it, as well as make sure people had internet accessibility. So it's taken us some time to get that done, but would encourage those questions about specifically what is provided to the students right now. I'd refer that to the school district. They have sent out learning packets that we helped print at our prisons. That was also distributed at every meal site as well.
Speaking of the prisons,
Corey, we'll make this the last one.
Okay.
We do have a number of other speakers and limited.
Yeah, just real quick on the prisons. So you said there are 64 now cases among inmates.
Yes, there are 64 inmates currently with the infection. There are a few that have recovered. And so that's the number who are currently have the infection.
So what is the protocol for testing then? Who gets tested and do they have enough tests? Do you want to test everybody?
They have enough tests to do all for whom it's appropriate. It doesn't make sense to test the entire jail, but they're testing those people who are symptomatic and those people that have concerns about that may have been in contact with those who are symptomatic. That's up to the discretion of the folks working with the medical professionals in the jail in consultation with the health department.
Yeah, and just to be clear, anyone who is showing symptoms is isolated and tested and remain in isolation until those test results are returned. And they are also tracing each case and quarantining any inmate that had ongoing contact with those being tested.
Great. Thank you, Corey. And next up, Pat Loeb of KYW. Pat, are you there?
Yeah, I was trying to turn my camera on and unmute myself.
You're unmuted, so why don't we go ahead?
Okay. I had two questions for Dr. Farley. One is, yesterday you said the federal government was looking at the percentage of positives on the test to come to the conclusion that this might be a hotspot. What is the percentage of positives?
Well, it's varied over time. It started out pretty low, about 5%. Then it peaked above about 35%. The last number I saw was about 30%.
And is that because you're only testing people with symptoms and just because you've narrowed the parameters for testing, do you think? Or?
We've had pretty much the same criteria since the beginning of this. That increase really is very much in parallel with the case numbers that we're reporting every day. And it's been going down the last couple of days. That's in parallel with the case number stabilizing. So we're going to track that as another indicator.
Okay, and anecdotally, people have at our station been observing some more traffic on the road. Earlier this week, you mentioned a Google travel tracker. Have you looked at that lately? Is the kind of thing that's constantly updated, and do you have a feeling for whether maybe more people are venturing out?
I have not looked at it in the past few days. It's open on the web, so I suggest you look at it yourself. I'll look again now, but I haven't looked at it since we put out a few days ago.
Okay, thanks.
All right, thank you, Pat. Next up, Mike Donofrio of the Tribune.
Hey, this is for Dr. Farley. Can you just elaborate on the different sources you're investigating to get better data on the race and ethnicity of those testing positive for the virus?
I don't think I have more detail to give you other than to say that we get reporting from many different sources for different problems, such as vital statistics, births and deaths, et cetera. And so we're seeing whether some of those databases we can link to the databases of reported coronavirus infection, and through that linkage then pick up demographic information like race.
All right. And can I ask why hasn't the administration been doing this before? Is this just, sounds like this isn't necessarily new data, but was it just previously not available?
I'm not even sure that it's going to be possible that we're going to be able to pick this up much. It's not something we do ordinarily. And you know, there's been plenty of other things we've been working on.
All right. And you said you were more hopeful that you could get, I guess, better figures from these sources. Can you maybe just elaborate on that? Do you think you'll be able to share some of these figures next week?
I'm hopeful that we can share some next week. I can't guarantee we're going to have any more or much more next week. But if we have them, I will absolutely share them.
All right. And you think they'll be better than the current 15% of cases that you're getting in terms of...
I'm hopeful. I know you want me to answer this question. I don't have the answer, but if I had it, I'd give it to you.
All right. That's all I got. Thank you.
Thanks, Mike. Our final questioner for the day is Denise Clay of The Sun.
Good afternoon, everyone. This is a question that I wanted to ask the mayor, because he said that, even if we, do kind of flatten the curve, we're still going to be, not necessarily going back to normal for a while. What does that mean for things like Welcome America? Normally by this time, we're actually talking about, Welcome America and what's coming up and stuff. And there are other music festivals and things that have been postponed until August that would normally be happening within the next couple of months. What is the status of Welcome America, or have you all thought about that?
We haven't made a decision on Welcome America. Obviously, it's a large gathering of people in a concentrated place. So we have to see what the conditions of the region and the nation are at the time. Obviously, people would be coming in from other areas. So it's very problematic and very complicated. I'm not, it's the same with professional sports. We don't know if there's going to be a baseball season. We don't know whether or not there's going to be an NBA playoffs or a finish of the hockey season, or whether the Eagles are going to start on time in September. So we'll make a decision, I assume, relatively in the near term, but no decision has been made yet. And that's the kinds of events that scare us because there are so many people concentrated in one spot.
Denise, are you good?
Yeah, I'm good.
All right. Thank you very much. I did want to point out Brian Abernathy was able to get an update on the meal distribution this week. 289,762 meals going to 46,934 students. That was this week alone, and 32,000 boxes of food through the general distribution. And Brian also clarifies that remote learning for the school district begins on April 20th. Brian, did I get that right?
Yes, sir. Thank you.
All right. Very good. Thank you, everyone. We will resume the 1 p.m. daily press briefings next month.
Have a nice weekend.